Hello everyone, I am Dr. Shravya, consultant in the Department of Balaroga from Sharada Ayurveda Medical College, Talapady. So, since the global pandemic of COVID has started, what we have noticed is that the recurrent infections or the respiratory infections, mainly the common flu or the common cold and cough, has drastically come down. So, what we can know from this is that everyone has taken the simple kitchen ingredients from their own home and prepared various decoctions or various formulations, or maybe the golden milk, the just haldi and milk preparations, and have been taking it daily as an immunity booster and to keep the infections at bay. Mainly it was proposed for the COVID, but what we have seen, the result from this is all the common routine cold, cough and all those infections have come down. So, what we can see from this is that the medicines the common ingredients which we have been using from our kitchen is helping us to build our immunity on our own, and also helping us to keep away the infections, and also in case of such infections, even if it is happening in us, it is controlling the infections at our home itself. We have not gone to clinics, we have not gone to hospitals to get it checked or get it treated with other medicines. So, the main topic which I want to concentrate today is about antibiotic resistance or antimicrobial resistance. It is a globally significant topic nowadays. What is an antibiotic? As we all know, it is a medicine which is given against a bacterial infection or any microorganism. So, when this antibiotic should be given, it is decided by a doctor based on the symptoms or clinical signs a child presents or any person presents. Maybe when the symptoms are increasing day by day, or the symptom is taking more than a week to come down, in such a case an antibiotic is usually prescribed. So, what is happening nowadays is that the over usage of antibiotics or the exaggerated usage of antibiotics has caused such a change that the organism itself is changing, genetically mutated, so that a new resistant organism to that antibiotic is formed. So, what happens is that the previously antibiotic which we were prescribed won't cure the same infections in due course of time. So, what will happen in future is that one antibiotic is not enough to control an infection. So, multiple antibiotics have to be given. So, this is how the trend of multi-drug resistant tuberculosis and such grave diseases have been coming up. We have all seen in this pandemic time or during this lockdown, we have used all these drugs in our routine practices, and what I am trying to say is that we can use the same medicines or with the help of some extra medicines which an Ayurvedic physician knows better about. You can go through it and get those medicines. These medicines act in two ways. Mainly it cures the infection in the person, and also it helps the immunity, so that in due course of time you won't be getting such recurrent infections in you. So, what an antibiotic can do, that is only a one action, it kills the infectant in your body, but what the Ayurvedic medicines or Ayurvedic preparations can do is that it also cures the infection, and also it gives you the immunity power to fight against the future infections in you. So, instead of taking our children every time for a recurrent infection to a clinic and getting prescribed by antibiotics, maybe we can choose Ayurveda and get our drugs and keep our future generations healthy. Thank you.